Rocket Right Show. I'm Dr. Kay Solar in the house with Hurricane Betsy Barnes, and our medical segment is brought to you each week by Mary Bird Perkins, Our Lady of the Lake Cancer Center. And we're so glad tonight to have Dr. Jon Olson, who is at the NeuroMedical Center, a neurologist, neuro-oncologist. You got all those titles going on and lots of studying behind it.
All sorts of fun stuff. Yep.
But you're going to tell us about, I know the two groups have had a long-standing partnership, but I think we wanted to talk about there's a research agreement that's going on between the NeuroMedical Center and Mary Bird Perkins, Our Lady of the Lake Cancer Center. And so tell us about that research.
Well, thanks, Kate. Like I was talking to Betsy, I've been at the NeuroMedical Center for about 20 years, and my specialty is in brain tumors, and we've had a fantastic working relationship with Mary Bird over that time that I've been there, even preceding that. And they have the gamma knife treatments. I treat a lot of brain tumors that require radiation, and a close working relationship with the radiation oncologist, and I'm treating some of the chemotherapies, treating the seizures on my brain tumor patients. And so we've worked very synergistically over the years. We've had a few clinical trials over the years with them as well. There was a vaccine study for glioblastoma patients a few years back. So when I had the opportunity to get a new study using a device called Optune, the name of the study is called TRIDENT, and I've been pushing them to get this going as fast as we can. I want to get more options for my glioblastoma patients, and we've been using the device called Optune for a few years now. I think I'm only one of two doctors in all of South Louisiana that's certified to use that. And what we've done with glioblastoma over the years is treated it with radiation. Then we found that adding chemo with radiation helps, and then using the Optune device after we're done with that phase of things. Now we're looking at using the Optune device synergistically with radiation, because it has a different mechanism of action compared to the radiation and compared with the chemotherapy that we can give, and their toxicities are not overlapping. And what I've seen in my time at NeuroMedical is we've taken, the radiation treatments alone, we found the chemo helped. Then we found that the Optune helped. And we're trying to incrementally increase survival and progression-free survival for our brain tumor patients. And the thing that really has come to head that's new between NeuroMedical and Mary Bird these days is a agreement to do more research, to expand the power of our group. And in research, collaboration is key, and that's what we've really locked down even more than we've done informally over the years.
That's great.
Exciting.
Now, when you're talking, if I'm listening, I'm going, okay, Optune, exactly what does that mean? Because everybody's familiar with chemotherapy,
I'm so
radiation
stuck in
therapy,
my world. This is a new thing.
But people are going, what does that mean? What type of treatment is that?
So it's really different than radiation. It's different than chemotherapy. It's different than surgery. And basically, it is a tumor treating field device. For the brain tumor treatments, you have to shave your head. And then you have these arrays, and they kind of stick on your head. You got one, right, left, front, back, and we kind of move those arrays around a little bit depending where your tumor is. And has these tumor treating fields, your head feels a little warm. You wear it about 24/7 because cancer's growing, trying to grow 24/7. And it messes up the way that these cancer cells are dividing. It misaligns them. You can't do it. They kind of crumble. They can't divide as fast, and that's the idea. And you want that on 24/7 as much as you can. It hooks up to a little 3-pound backpack.
Okay, and so when you say they wear that 24/7, like,
you can take
the
it
whole
off
time
if you
during
want
their
to
treatment?
change it. If
they-
you want to take a shower, you just put a little shower cap on. If you get a little redness in your skin, you can take it off, take a little breather. But some of the studies have shown that when we use it, the 95% user lives a little longer than the 80% user. then lives a little longer than the 75% is actually the goal on the studies of how long to wear the device.
So it's sending radioactive waves, so
It's
to
not
speak?
radioactive.
So what kind
It's
of...
different than radiation.
Okay.
And it's more, think of it more as a magnetic, and it realigns because every molecule has a polarity, a positive and negative. And if you are trying to divide like that, and you need things in a very organized fashion, and you have this polarity constantly switching this way, 200 hertz, 200 times a second, it's doing that. It can't divide like it needs to.
Yeah. So
That's
is this
incredible,
something
really.
that in your treatment, is this something that is used early on in somebody with a diagnosis of glioblastoma, as far as in the research or
the
your
device
treatment?
was approved initially for people who've had a recurrence down the road.
Right.
And should we use chemo, should we use this? And it works about as well as chemo. We move it up. And then there was another study that used it in newly diagnosed patients after they finished radiation, and that showed additional benefit in that setting. Now we're trying to move it up again because we know more about it, and there's been some good preliminary data showing that using an all up front, different mechanism of action will work hopefully even better for the glioblastoma patients that we see. So.
And you're okay. We're gonna rein it back in again, because a lot of folks may be listening. They go, glioblastoma, what is that? We know, I mean, from a medical standpoint,
Oh, yeah.
that is a very devastating,
Aggressive.
It is,
tumor.
and
But
it's-
talk about it so that people know.
So
I
it's
mean,
a
what's
primary
the
brain
incidence,
tumor.
and yeah,
And primary meaning it started in the brain. There's lung cancer, colon cancer, breast cancer that get to the brain spreader, but this is a tumor that starts in the brain. And it is, the glioblastoma is the most common of the malignant brain tumors. It is fast growing, and people may be familiar with John McCain, who passed
Yes.
from a glioblastoma. And Ted Kennedy, several years prior, passed from a glioblastoma. And it can be fast growing and recurrent. We need a lot better options because of that.
Well, and to mess up the cancer's ability to grow and reproduce, especially in a fast-growing cancer, can really save someone's life.
You can
It could
buy them
change.
months, you can buy them quality time. Yeah, will it make them live forever? I can't promise that.
None of
but-
us are going to live forever.
Right.
But it's really amazing that you're able to do research, because what you find through this partnership and this research ongoing is going to spread educationally
Well, I think
throughout
the
people
bigger the
treating.
group, the more collaboration, the more studies we can find, the more opportunities for my patients for glioblastoma that needs a lot of help. We need better treatment options. But I'm hoping even for other things that we see that may not be as aggressive cancers or
right.
things like that, but still are important, can affect quality of life, and any options, I'll take them.
That's right.
Yes.
That's right.
Absolutely. And you had said y'all have done things in the past. This isn't new, but what is new is that the partnership is a little bit more sealed for doing more.
Right,
research.
and some of the National Cancer Institute, there's some community outreach programs that are part of this, and they're trying to reach people who may not have the options, they may be underserved.
Right.
There's more resources to use to get them into these trials, supported through that, and people who go through clinical trials, they do better. Now, why is that? Are they younger? Or is it just all the other support they have? And I think there's probably a combination of the two. Yeah.
And they have hope,
there's
encouragement.
something to say too about that multidisciplinary care that they have that's been ongoing, at the cancer center. And so, like you said, that helps with patients, just because you have so many different people collaborating, hearing their case and their story.
Yeah, we have conferences a couple times a month where we show films, interesting things, put everybody's head together. We've been working like a well-oiled machine. We know everybody well. We can call
That's
them
great.
up, send them a quick little text, trying to be privacy compliant.
Yeah, absolutely,
And
for sure.
really work to coordinate care. And I've enjoyed that relationship, and I'm glad to see this as something that will expand our reach, let us do more.
That's great. And so if someone wants more information, I think we have the website down there to go to, the neuromedicalcenter.com. And they can always go to marybird.org also for more information on this.
Yes, ma'am.
Well, we appreciate you being with us, but I want to, this is like quiz time. This is easy quiz time. You know, you've been talking all the hard,
think he can
difficult
answer all
stuff,
the questions.
right?
I don't think you're going to
So
stump him
mine
here,
is,
Kay.
what is your favorite king cake? It is that time of year.
Cinnamon. I'll go with the cinnamon.
Okay.
Well, you're going to have to hang around and try the Bavarian cream strawberry king
Yes.
cake.
You guys are living like kings here, so
That's right.
We are. We figured
this
we
is
were
like almost too
combining
much fun for me. Yeah.
Valentine.
Well,
We're
come back
combining
again.
Valentine and Mardi Gras in the Culinary Productions chocolate Bavarian cream strawberry king cake. I can't even get it all out.
That
There's
looks
so
like
much stuff on
amazing
that
therapy.
king cake.
It is.
It is.
That'll
It is.
cure you.
It is
If you're in a bad
amazing
mood, that'll
therapy.
cure you. So stick around and we're going to have some king cake.
Sounds
For
good.
sure. And so, tell us, are you originally a Louisiana boy, and is this new to you, or is this new to you, the king cake stuff?
No,
I mean,
king
I know
cake's
you've been
not
here
new.
for.
I've been in Louisiana for a mere
long time.
20 years.
But how about from the babiness up? From the babiness up.
when we got here,
was you born here, or
when I
you
came here
just got
20 years ago,
of
I knew
king
there was
cakes?
good food. We had been some time here before. Why do you think I've stayed so long?
That's
Yeah.
right. And we hope you never leave.
No.
We appreciate what you're
No,
doing
we're,
so
we're having a
much.
good time. All my patients are amazing. All the families, all the support.
That's great.
The NeuroMedical Center, all my partners. It's been a great ride, and I'm
Awesome.
looking forward to more, especially with these new opportunities.
Well,
Come back
thank
and
you.
tell us all about it as y'all develop this. We look forward to having you.
Yes. So we've been
Thank you.
talking with Dr. Jon Olson with the NeuroMedical Center, neurologist, neuro-oncologist. He does it all over there, and he likes king cake. And up next, we're going to be talking about Valentine's Day more with Rouge Creole's New Church. So stick with us.